such as surrogate motherhood, the freezing of embryos, and experimentation on embryos. Hong Kong's first test tube baby was successfully delivered last December, a 3.5-kilo baby boy. For his mother, it was one of the most memorable events of her life. In this documentary, she's known as Ah Fong. She and Ah Ming had been married for 7 years. They had always wanted to have a child of their own, but for 7 years they had no success. Just as they were about to give up all hope of ever having a baby, the medical experts in Hong Kong managed to grasp the technique of making test tube babies. And through this expertise, a boy was finally born to Ah Fong and Ah Ming. Ah Ming and Ah Fong both loved children. Ah Ming had considered adopting a child, but he thought, given his financial situation, his application would never be successful. In the end, it didn't apply. Ah Ming is a driver. Ah Fong works in an electronics factory. They live in a temporary housing area. Both approaching 40, the inability to have children left a major void in their lives.
老仔咧咪好覺得自己好寂寞咁咯，有陣時兩個大人喺做完嘢翻嚟，有咩寄託啫你自己？嗱，你而家都有啲寄託啊，希望下一代啊，養大佢啦，供書教學啊，你都有個希望啊。
有細個好與唔好就另外一件事啊嘛，即係起碼即係話可以即係一代傳一代咁樣。
It's estimated that 1 in every 7 couples throughout the world has difficulty in having children. The particular difficulty in Ah Fong's case is a blockage in the fallopian tubes, which is the most common problem found in barren women. Ah Fong felt upset and guilty that the fault lay with her and that she couldn't fulfill a wife's responsibility. She was also afraid of being ridiculed for being barren. For 7 years, they had been saving every cent in order to consult medical specialists. They had even made special trips to Southeast Asia for this purpose. But every time, the result was disappointing.
譬如月經嚟啊，咁觸景傷情咯，即係月經嚟啦，咁即係又失咗個希望啦，咁咯。月經未嚟，咁你梗係有個希望啊，可能過期啊，過咗期啊，咁啊有啲希望咯。月經嚟咯，即係冇啦呢個月。
即係成日一翻屋企，如果聽佢講嗰時話啊嗰啲又嚟啊咁啊又，唉個心咧就好似有啲即係冇咗希望咯，成個人傻晒咁咯。
Early last year, when Ah Ming and Ah Fong read from the newspaper that medical specialists in Hong Kong had learnt the technique of making test tube babies, they decided to give it a try. The doctor extracted eggs from Ah Fong, fertilized them, and then returned them to her womb. The fertilization was successful at the first attempt, and the embryo developed normally. This film was shot when Ah Fong was 4 months into pregnancy. The doctor was extracting amniotic fluid during a regular checkup.
睇到 BB 肉啊！呢個 BB 好好，呢個頭啊，啲眼啊，呢個鼻啊。
踢得好犀利。
係咯，踢到啊頂住。
我踢喺嗰個頂嗰個位啫。
少少啦。
嗰個今日我咪個位冇試好多。
The happy mother-to-be was excited about the prospect of having a baby. From now on, nobody would taunt her for being infertile. When the time was drawing close for the baby to be due, Ah Fong started to feel nervous. The whole operation of in vitro fertilization, or IVF, cost $40,000. This was all the savings they had. Would the money be wasted? Before they could actually see the baby after birth, they could never be certain if it would be normal, even though the records worldwide should have given them some assurance. This procedure has been used for some years outside Hong Kong. The first test tube baby in the world, Louise Brown, was born in Britain in 1978. She's now 8. Her younger sister, who is now 3, is also a test tube baby. They are both growing up normally. Around the globe, there are over 1,000 children who were conceived in the test tube. The rate of abnormality among test tube babies is actually lower than normally conceived babies. In every 1,000 normally conceived babies, 30 are abnormal, whereas among the 1,000 test tube babies so far born, only 2 have been found to be abnormal. When compared with other countries, Hong Kong is only a beginner in terms of the study and achievement of test tube babies. The government first set up a special clinic in Prince of Wales Hospital, overseen by staff from the School of Medicine of the Chinese University. Up to last year, the method has been tried on 60 infertile women. The majority of IVF patients are infertile as a result of problems with the fallopian tubes.
That's the one we're in before, the very bottom.
Queen Mary Hospital, with staff from Hong Kong U School of Medicine, didn't start looking into IVF until June 1986. Up to now, they have performed this operation on 19 people. At present, there are 18 people on the waiting list in Queen Mary Hospital, and about 4 new cases come in Prince of Wales Hospital each week. Since they are still in the experimental stage, the hospitals only accept referral cases, and the operation is free of charge. The only place that will accept patients without referral is a private clinic called the IVF Center. The fees are about $40,000. The center was opened in February last year. They have already performed IVF on 50 infertile women, and there are 15 waiting. Embryos formed in the test tube and later implanted into the mother's body have a survival rate of only 5%. Among a total of 110 patients in Hong Kong who have received in vitro fertilization, Ah Ming and Ah Fong are the first couple to successfully become parents. When does life begin? To this question, there's no consensus among medical people. Many feel that life starts the moment an egg becomes fertilized, when an embryo is formed. They think that to create a baby at the expense of many living embryos is too great a price. On the other hand, doctors think IVF is a breakthrough in treating infertile women. It's a spectacular achievement in medical technology. But first, what is IVF? First of all, the doctor will give the patient several injections to induce ovulation, so that the ovary produces more than 1 egg at one time. While the patient is receiving injections, the doctor will monitor the maturity of the eggs with ultrasound scanning. If everything is all right, the eggs will be extracted within 36 hours. To do so, ultrasound scanning, or laparoscopy, is used to identify the exact location of the eggs. Then they are removed with a cannula.
Two more bit of urine to go from. Well, same side, a different side. What do you want to do?
Same side for one more.
Okay.
The embryologist will immediately look to see if there are eggs in the extracted sample. While the eggs are being extracted, the husband has to make available sperms, and the embryologist will place both the eggs and semen inside the test tube. In order to provide a better chance of pregnancy, the doctor always tries to extract 4 eggs and fertilize them. If all 4 eggs are successfully fertilized and develop into embryos, the 4 embryos will be returned to the patient's body. That means if all 4 embryos grow successfully, the patient will end up with quadruplets, although this is unlikely. Now we witness an infertile couple receiving IVF. We call them Awai and Asan here. After Asan has received injections which excite the ovary, she produces more than 1 egg. With the aid of the ultrasound scanner, the doctor can see the number of eggs and their level of maturity.
應該呢邊有，即係至少呢兩個有機會㗎啦。左手邊嗰兩個有機會，咁應該今次都應該有攞到3、4個出嚟㗎啦。
The size of the follicles indicates that Asan is at her peak condition for impregnation. The doctor will extract her eggs within 36 hours.
今晚你10點半到打咧，咁我哋就朝頭早8點半做，即係差唔多34個鐘頭到咧。咁我哋就啱啱即係等佢到成熟到最頂點，但係未曾自己排卵嘅時候，我哋就幫佢攞出嚟啦。
With the laparoscopy, the locations of the eggs are ascertained and they're extracted with a cannula. On the other side of the operation room, the embryologist sees if there are any eggs in the extraction.
Cells but no eggs.
Cells, no egg yet.
Asan's husband has also made available the sperms. The doctor hopes to extract 4 eggs, but normally only 80% of the eggs produced can be successfully retrieved.
Yes, 1 egg in the last sample.
1 egg!
In the end, the doctor extracted 3 eggs from Asan.
同你攞咗3隻蛋出嚟啦，而家自己大啖唞氣，深呼吸，啲氧氣對身體好嘅，聽到嘛？再深呼吸俾我睇下啦，太太。
The embryologist first nurtures Asan's eggs and Awai's sperms and selects the most active sperms to place in the test tube with the eggs. This is what we see through the microscope when the egg is being fertilized. This is Asan's egg before fertilization. Now, Awai's sperms are put in. Among the tens of thousands of sperms, only 1 will fertilize the egg. After fertilization, the egg cell begins to split and develop into an embryo.
你嘅3粒卵子咧就受晒精，而家就變咗3個胚胎出嚟。咁一陣間移植咧就將你3粒受精卵擠翻入你嘅母體入邊嘅子宮入邊㗎啦。
All 3 eggs extracted from Asan have been successfully fertilized in the test tube, and these 3 embryos could possibly develop into 3 babies. In order to increase the chance of pregnancy, the doctor puts all 3 embryos into our son's body. The embryos in the cannula are put into our son's uterus through the vagina. Science is not yet able to control the growth of the embryos within the uterus. Normally, each embryo has a 5% chance of successfully adhering to the wall of the uterus and developing into a baby. This clinic has so far implanted 53 embryos in a year's time, but only 4 have successfully remained in place and have not been aborted. Government hospitals have implanted altogether 210 embryos, but at the moment only 3 remain.
點解即係呢胚胎擺入去個母體之後咧，成功嘅機會係咁細咧？
呢個原因係多種嘅。第一，你成個試管嬰兒嘅嗰個過程咧係好唔正常嘅。個媽媽食藥打針，等多個卵子發展，佢啲荷爾蒙咧同平時啲荷爾蒙嘅分泌咧就有啲出入啦。第二，普通自然懷孕機會咧，小產咧都係成4-5成嘅。咁試管嬰兒咁嘅情況之下咧，佢點都唔會可以比較好過自然懷孕嘅機會嚇。
To increase the rate of success, the doctor implants several embryos at one time. If 4 embryos are implanted, the success rate is raised from 5% to 20%. And this is the basis of controversy. Some feel that the moment the egg is fertilized and cell division begins, life starts. Therefore, putting several embryos into the mother's body experimentally, in full knowledge that their chance of survival is small, is tantamount to abusing life. Father Brady of the Hong Kong Catholic Diocese has written a book in which he criticizes IVF. He points out that statistics from Britain and Australia in 1981 reveal that out of the over 1,600 embryos treated, only 16 babies were born. He thinks that in order to make test tube babies, scientists brutally damage other lives. He feels this is utterly immoral. Father Brady's opinion reflects the attitude of the Catholic Church.
好可能啊，胞胎已經係一個人，即係未發育嘅人，係可以話係有潛能嘅人。佢漸漸會發展，漸漸發育，但係已經人所需要嘅佢自己嘅獨性已經喺度。如果係咁樣咧，咁佢有生存嘅權利啊，就我哋應該尊重佢啊。如果你咁樣破壞佢，利用佢先，咁等佢又破壞佢，你已經違反佢自己嘅權利，又好唔公平。
Father Brady stresses that test tube fertilization is a scientific skill which reduces childbearing to a clinical procedure. Doctors argue that their duty is to treat patients, and IVF is the only available method that helps women with blocked fallopian tubes to bear children.
咁你要睇咧，就喺呢筆人嘅夫婦裏邊咧，如果佢唔做咧，就變咗得0%嘅機會。咁佢哋根本冇辦法受孕嘅。咁喺醫生嘅立場嚟講，我哋做醫生最重要咧就係盡我哋嘅努力，盡我哋嘅學識咧去幫助病人。如果有呢種科技而家可以幫到呢一部分、呢一小部分，除非我哋幫佢手，佢根本係完全冇機會嘅。咁我覺得咧，我哋已經成功咁幫咗佢哋啦。咁就我哋又唔係話將嗰個胚胎嚟做實驗，我哋又唔係話將個胚胎養到即係過咗期。咁我相信咧，就應該我哋唔會妨礙到即係道德呢個問題。恭喜晒，擺晒落去咯喎。咁你而家照顧住佢嚇，唞下嚇，大家希望有好結果啦。
To satisfy their own desire to have children, parents of test tube babies put at risk other potential lives in order to make one baby. Some regard this as selfish.
如果係佢哋生育啊，已經一個細路仔出世咧， 佢哋肯唔肯將一個犧牲啦，為救另一個，就殺一個，為救一個，故意咁樣。有啲人會話咧，你用呢個方法咧，好似係父母係為滿足佢哋自己嘅需要，佢用呢個方法。咁佢哋話咧，好似係當佢哋嘅仔係好似一個工具，為滿足佢哋自己嘅需要。
擺3個胚胎落去，只不過咧係我哋想俾個病人咧一個最好嘅機會。嗱，呢3個胚胎擺喺裏邊咧，亦都有個天然選擇。咁如果佢係1個胚胎得，咁1個 BB；2個胚胎得就2個 BB；3個胚胎都可以喺裏邊生存咧，適應到裏邊嘅環境咧，咁呢度再就變咗有3胞胎啦。咁因為呢個係天然選擇咧，所以就同天然係完全一樣嘅。咁我相信咧喺呢一點上邊咧，就唔應該有咩爭論。
What's the opinion of our Wayana son, who may well benefit from the scientific leap?
可以咁講啦，即係譬如而家一個胚胎放落去，喺我心目中差唔多係只係屬於一粒種子啫。佢發唔發芽，只不過係等佢自己嘅發展。所以我覺得佢成功係好嘅。如果譬如有1粒或者2粒唔成功，對我嚟講，我唔覺得有咩內疚。
The procedure of embryo implantation is completed. Now, luck will decide whether the embryos will grow in Asan's womb without complications. 2 weeks after the operation, Asan aborted. All 3 embryos implanted inside her were lost. Nevertheless, for many, it's good news that medical specialists in Hong Kong are able to use the technique of in vitro fertilization successfully. But the controversy remains and could widen in Hong Kong to include other areas of concern, such as surrogate motherhood, the freezing of embryos, and experimentation on embryos. As science progresses, these questions may be hard to ignore.